Hello, audience, and welcome. Today's show is a gripping tale of ethics, life, and death. This is the scenario. Here we are at the G.F. Hoover Medical Center. Our story today will take place inside of the ER, where we will find Nurse Sam making his first rounds of this morning shift. He will soon be receiving SBAR on 2 recently admitted patients and must decide how he will utilize his time and resources to provide optimal patient care. Ladies and gentlemen, I present to you the allocation of scarce nursing resources. Let's have a look inside.
Hi Sam, today your 2 patients are Miss Karen in room 203 and Miss Lizzie in 204. Miss Karen is a 36-year-old female who came in for dehydration because she overworked herself. She has been here for the last 24 hours and I was not able to change her IV line during my shift. She's being discharged today and I recommend changing it within the next hours and be aware of her intake and output.
Okay.
She's a very clean and organized person, so be aware of her status. And then your next patient is Miss Lizzie, who is an HIV positive homeless 21-year-old female and has not been having urinary retention for the last 2 days. She was not able to void throughout the night and the provider has ordered a catheter to be inserted at 6 a.m. this morning. I was busy with another patient and could not insert it. Therefore, please insert it within the next hour or so. And then, by the way, we have a sterile glove shortage, so we only have 1 pair of sterile gloves left.
Okay, sounds good. Thank you. Knock, knock. Hi, I'm Sam. I'm going to be your nurse for today. Could I get your name and date of birth?
Karen Smith, May 20th, 1985.
All right, awesome. That matches. And we're going to be changing your IV line today. Is that okay?
Are those sterile gloves?
They're
I
clean.
don't want you to touch me with your dirty hands. They need to be sterile.
Okay, I'll go and see if I can't get them sterile gloves.
Thank
for
you.
Got these sterile gloves for you. Now we can begin the procedure. Knock, knock. Hey, Lizzie. I'm Sam. I'm going to be your nurse for today. Can I get your name and date of birth?
Lizzie Jones, January 11, 2000.
All right, and then it looks like you haven't been able to pee in the last 24 hours. So the doctor put in an order for a catheter, so I'm gonna go and do that for you. Is that okay?
Whatever, I gotta go. I can't afford to be here, so just make me pee already. I don't have insurance. Let's go.
Okay, I'm gonna go grab that kit for you and I'll be right back.
Whatever.
Oh shoot, those were our last pair of sterile gloves. Oh well, these will do. All right, looks like I'm gonna start your catheter.
Did you see the problem? Due to Nurse Sam's actions, Miss Lizzie was later diagnosed with a COTI. Because of her compromised immune system, even a simple infection could have devastating consequences. Her infection moved upwards and evolved into pyelonephritis, which then progressed into septicemia, ultimately leading to Miss Lizzie's untimely death. Let us now look at a different scenario, where Nurse Sam chooses a new course of action.
Are those sterile gloves? I don't want to be touched by your dirty hands.
I understand your concerns, but this procedure doesn't require sterile gloves, and these ones are clean. They should work just fine.
Okay.
All right. So the doctor put in an order for a catheter, so I'm gonna go and do that for you. Is that okay?
Whatever, I gotta go. I can't afford to be here, so just make me pee already. I don't have insurance. Let's go.
Okay, I'm gonna go grab that kit for you and I'll be right back.
Whatever.
All right, also too, I was able to talk with the social services and we're gonna find a way to help you with the cost, okay?
Marvelous work, Samuel. As you can see, dear audience, when we pause and put our nursing brains to use, the patient outcome can only improve. Because Sam followed sterile technique, Miss Lizzie made a full recovery and both patients were discharged with no further complications. Thank you for joining us today. This has been the allocation of scarce nursing resources.
Hello, everyone. Thank you for watching our video on the allocation of scarce nursing resources. We will now be going through the PowerPoint for this presentation. This is Lizzie. Lizzie is a 21-year-old female admitted to the emergency department. She has been experiencing urinary retention for 48 hours before being admitted. Lizzie is homeless and does not have access to clean facilities most days out of the week. She also does not have health insurance. She has been agitated since arrival. Her care team has decided to insert a Foley catheter in order to obtain a urine sample and help Lizzie void. This is Karen. Karen is a 36-year-old woman admitted to the emergency department. She has experienced syncope at work after feeling dizzy. Karen is very busy and works an average of 60 hours a week. This is the first syncope episode in 4 years. Karen is worried about her job and has been tense since arrival. She is very concerned about infection and repeatedly asks staff to wash hands or make sure tools are clean. Karen's care team has diagnosed her with dehydration and has decided to insert an IV to deliver fluids. Let's debrief this scenario. First, what is the scarce resource? The emergency department was experiencing a shortage of sterile gloves. What went wrong? The nurse chose to allocate sterile gloves to the patient concerned with germs rather than the patient receiving a catheter. How was it resolved? In the second scenario, the gloves are allocated to the correct patient. And finally, why does it matter? By following the correct procedure, the nurse prevented a CAUTI that led to the patient's death.
Next, we have the 4 A's to rise above moral distress. These 4 A's include ask, affirm, assess, and act. Ask. The RN within the scenario could reflect within and ask questions such as, am I stressed? Do I have the necessary equipment to perform the tasks that I need to do? Is there the possible outcome that could affect or harm another person if I don't follow the correct techniques with the correct equipment? Answering and asking these questions allows the nurse to become aware that there may be moral distress within the allocation of scarce resources. Affirm. Validate these feelings and perceptions with others. The RN addressed these questions when, in the rewind, he made sure to use the correct equipment that was needed for the procedures. Assess. The RN identified the shortage of gloves in the rewind portion of the video. This was the action plan, which is the goal for assess. Lastly, we have act. Taking all of these elements into one, and you come out with a better preservation of sterile gloves or any other resource this could be applied to. The nursing process. Assessment. Lizzie had urinary retention, homelessness, lack of clean facilities, no health insurance, and was agitated easily. For Karen, her assessment was the syncope episodes, dizziness. She was tense and concerned with infection. Next, we have diagnosis. Lizzie had the medical diagnosis of urinary retention. Next, Karen had the medical diagnosis of dehydration. This was related to ineffective health management related to the lack of knowledge on how to prevent the syncope episode. She also had deficient fluid volume related to active fluid volume loss. Next, we have planning. Lizzie had urinary catheterization and urinary retention care. Next, Karen had education and fluid management. Next, we have implementation. Lizzie had catheterization and Karen had IV fluids and syncope education. Lastly, we have evaluation. Lizzie was able to void and obtain a urine sample. It was discovered that the urinary retention was related to HIV. Lizzie was treated and education on prevention strategies. Lizzie was also connected with a social worker. Karen recovered from the syncope episode after receiving adequate fluids. Next, we have examples. So I'm going to give 2 examples that show another allocation of scarce resources. So during the COVID-19 pandemic, there has been a shortage of ventilators in the country. The choice of who to give ventilators to has been an allocation of scarce resource issue. In the other one, the other example will be an increase in staffing shortages, is another example of allocation of resources. In 2015, nurses filed more than 2,700 safe staffing forms, which is an increase of 32% from that last year. That was our presentation, and thank you.
Knock, knock. Hey Karen, how are you doing this morning?
Good.
And then I was coming in here, we're going to have to change your IV line. Can I get your name and date of birth really quickly?
Karen.
Hey Karen, my name's Sam, I'm going to be your nurse for the day. Can I get your name and date of birth?
Karen Smith, and May 20th, 1985.
Awesome. And then we're going to be changing your IV line today, is that okay?
Are those sterile gloves? They
No.
have to be sterile gloves. You're not touching me with the entry.
1.
Alright, I'm gonna start your catheter.
I flipped the wrong side.
Oh shoot, that was our last pair of sterile gloves. Yeah, these'll do. Knock, knock. Hey Lizzie, I'm Sam. I'm gonna be your nurse for today. Can I get your name and date of birth?
Lizzie Jones. January.